Somebody call 911. If somebody acknowledges that they're calling 911, then that's all you need to do. Grab an AED. If somebody acknowledges they're getting an AED, then you can immediately go to the rescue efforts. If no one responds to you, or if there's nobody there, or nobody has a phone, nobody has another means, you need to find a means to get advanced care to this person immediately. So that means you have to leave this patient and call 911, find a phone. Everybody has cell phones now, so it shouldn't be that big of an issue. Take a second to call 911. Okay, now you're looking at this person. You're gonna need CPR. So we're gonna scan 5 to 10 seconds. We're looking for any type of chest rise, any type of movement whatsoever, okay? If you determine that there is no movement and you check for a pulse, there is no pulse, what I do, if you find the rib cage, if you're standing here facing the patient, the head is on the left, you find the rib cage with your right hand. You follow all the way up to where the ribs stop, and it comes to that V, that xiphoid process, where that tip of the breastbone, and you put your middle finger right there. You take your palm and put your palm above your hand then. You see how I did that? Okay, so you find the rib cage right up, put your palm on top, and you're at the bottom third of the breastbone. Okay, you're going to take then your right hand, almost like a magic act. You're going to take your right hand, place your right hand over top, and now this is very important. You don't want to push with your arms and bend your elbows, because what happens is, you get very fatigued, you get fatigued quickly, and once you get fatigued quickly, you're not doing proper CPR. Okay, so you want to use the least amount of energy for yourself when maximizing effort. So you find your bottom third, you put your hands over, you bring your shoulders directly over the breastbone, okay, and use your shoulders and the force of your body weight to push down, okay? So it's going to be here, all right? Now, how do you know if you're going deep enough, all right? Or if you're pushing hard enough? What you want to do, if there is another person there, you can always have them feel for a pulse while you're pushing, if you can feel the blood moving through. Okay, certainly if now what we would do on the advanced medical side is we would grab the feel for the femoral artery. Okay, if you don't really know where that is, I'm not going to really, that's a little bit more of an advanced technique, but you can certainly find the carotid artery. Okay, what does the face look like? Does it look like it's getting more and more pale, or does it look like maybe there's some color coming back to it? That's a good, and also a good indication that you're pushing the chest hard enough. One of the most important things about this is building up enough thoracic pressure inside, and the only way to do that is by pushing on the chest. After we get through all this, if you can't remember the rates, you can't remember the 2 inches of depth compression, you can't remember maybe the algorithm, just start pushing. The heart's not beating, beat it, okay? And you just come over. 2, 3. Okay? All right. So when you first open this up, so we've already moved through and you determined the scene is safe, you've determined the patient is unresponsive, you shouted for help, you called for an AED, you found your placement, you've scanned for 10 seconds, and you began CPR. Okay, now the AED arrives. Instruct somebody to open up the AED. Don't stop compressions, okay? If somebody says to you, yes, I know how to use this, I'm CPR certified, then instruct them to continue to turn it on. If they do not, it's more important to get this on at this point, okay? Because what's going to happen is this won't shock the heart if it's not in the appropriate rhythm. So the rhythm has to be either ventricular fibrillation or ventricular tachycardia for this to shock. If it's in another rhythm, it won't even recognize it, so you don't have to worry about that. First thing we're going to do, I know it seems kind of simple and kind of silly, but we're going to start with number 1. Okay, and it's simply just turn it on. Now, there are several brands. They all look a little different, but they all work generally the exact same way. And it's going to tell you what to do. So this thing just told you, place the patient, or place the pads on the patient. And if you're confused on where it goes, it just shows you right here. Number 1, push. What is it telling you? It's telling you to apply the pads. Well, where? Well, it shows you right here. So where do we insert the connector? Right where it's blinking. Okay.
Do not touch the patient.
It'll tell you to either say stand clear, don't touch the patient, whichever model you have. If you touch the patient, it could read your electrical activity.
Stay clear of patient.
Now it's charging. Now it's going to tell you to shock, and it's just simply blinking where to push. It's important at this point, make sure no one's touching this patient. Okay, the probability that somebody else will get hurt is minimal, but it has happened. It's happened to paramedics when we had the paddles. And then we simply stand clear, and you push this button.
Shock delivered.
And you start CPR right away again.
So a lot of it's, we know kids nowadays. So some kids are 12 years old and look like me at 28, and some kids are really tiny. What they delineated is signs of puberty. Kids are different. So initially, when we started doing CPR years ago on these kids, they're always like the one arm, and I'm sure that's what everyone's always been taught is one arm. Like kids are, you don't want to hurt them. Again, everyone's built differently. So if you have a 100-pound female, her doing one arm on a kid may not be as effective. So we want to make sure that we are the most effective that we can be. So that being said, you can use one arm or two hands. It's the same thing. We're going to bare the chest. Obviously, we're going to do our seat and size up. Hey, are you okay? This kid's not okay. We're just going to zip that back up. So, hey, are you okay? There's going to be no response. We're going to look for signs of breathing. Kids typically are going to breathe. If they're breathing normally, it's an even faster rate than adults. Okay. Same thing with pulse. So if they have a pulse, we want a faster heart rate, especially in the little kids. As they get older, heart rate kind of becomes normal like adults. So same thing. We want to on the lower 1/3 of the breastbone. For these kids, you're going to feel that xiphoid process come up. Typically, it's going to be right between the nipples. You know, adults vary in sizes and shapes. Kids generally, they're all same build. So we're going to place your hand, place it on top. Our goal for this, like adults we say is 2 inches. Kids is going to be just 1/3 the depth of the chest. Now, is someone going to whip out a ruler and say, you're going too deep? No. We want to make sure that, again, we're just getting effective CPR. So whether that's with one hand or two hand, that's up to you. Whatever gets the job done, that's the most important thing. So for me, it may be just one hand. But it's tiring. I mean, you can probably attest that when you're doing it, it's tiring. And kids, stressful. Like, that's the biggest thing. So you may end up having to do 2 hands, especially if you're doing it for a long time. Infants, again, I always remember when I first started this, when I took it when I was in middle school, and you took every 5 years it changes the standards. They used to say, if you're alone, it's just the 2 fingers. And then if you're with 2 people, it's thumbs encircling. But again, why force people into a specific form? You want to do what's going to work. If you can get effective CPR with 2 fingers on infants, absolutely, by all means go for it. But if you need to get that grasp around these kids to get the good compressions, do what you have to do. Infants are the same thing, just a different mode of it, okay? And that's what we don't want it to be intimidating. We don't want you to be afraid to have to do this. We want you to see this, recognize this, and do something. Basically, the kids, the only difference is going to be, again, the form of it, and the different sizes. For an AED use on kids, there are pediatric pads. You can use adult pads on a pediatric. They basically would, here it is. So it's got this box on here, so it takes the shock out of here and just lowers it a little bit, okay? So that it's not too much. So an adult pads will work on adults and kids, but you cannot use pediatric pads on an adult. It's just not enough energy to get through to the heart and actually be something effective. So if all you have is adult pads and you've got a pediatric, use them. But if you don't, unfortunately, just CPR.